Alright, so this is week 2 of nursing assessment. This week we are doing neck, lymph, and the abdominal cavities. This is my mom Susan, and we'll do an assessment on her. So, feel comfortable enough that we can do the assessment?
Sure.
So we're going to start with your neck. We're going to see if there's any bumps or bruises, any lesions, any issues there. If we pull her hair back, her neck is symmetric. Trachea runs straight down the middle. No issues there. Clavicles are balanced. And so that's good. So we'll move on to range of motion. So if you can tip your chin to your chest, and then back, and then turn to one side, and then the other side. Perfect. And then bend ear to shoulder, and ear to shoulder. All right. So a little bit of discomfort when turning her, or bending her neck with her ear to her right shoulder. And she attributes that to painting. So we'll move on to listening to her neck. We're going to go ahead and listen to her carotids and her thyroid, and then her airway. So I'm just going to listen to your trachea at this point. Just a little bit of pressure with my stethoscope. And we're just listening to the air move in and out. Beautiful. Perfect. And then we're going to go ahead and I'm going to take my fingers and follow your neck down to your thyroid. So thyroid there. The thyroid has 2 glands off this side. So we'll go ahead and listen to those, and then listen to the middle. So if you'll hold your breath for just a second while I listen. Beautiful, and you can breathe. And then one more time. Good. And then in the middle. Beautiful. At this point, we are going to go ahead and listen to her carotids. So, you don't have to hold your breath for this. And you can hear her pulse in her carotids just beautifully. Okay. We'll move on to palpating her neck. So I'm going to go ahead and have you just tilt away from me, and I'll sit behind you. At this point, you can inspect the back of her neck. No bruises, bumps, or lesions. I'm going to take both hands, go around the sides of your neck, and palpate your thyroid. Perfect. And then do one dry swallow for me. Good. The thyroid moves up and down. No issues or nodules with her thyroid as they move up and down. You can palpate her carotids at this point. So flat fingers. And you can feel her pulse, and then on the other side. So at this point, we'll move on to her lymph system. So if you want to turn straight to the camera, you take flat fingers and do small circles around where the lymph nodes are. You're going to do post-auricular, anterior auricular, submandibular, submental, post-cervical, anterior cervical, and then we'll do supraclavicular, and then infraclavicular on both sides. At this point, her neck and lymph assessment is complete. So we'll go ahead and have you lay down, and we'll cover you up with a blanket to give you some privacy. Perfect. And then we'll go ahead and lift your top up to show your abdomen. And then she likes her skirts this way, so we're going to zip her skirt down so that we can see all 4 quadrants of her abdomen. It's important that you pull whatever clothing that you have down far enough so that you can see the lower two quadrants. So for visual inspection, abdomen soft, non-tender. She can move well. Nothing is glaring or sticking out at this point. And she has no discoloration to her skin. So we will listen to all four quadrants. So just a stethoscope on your belly. You don't need to do anything. And she's got active vowel sounds in all four quadrants. We would listen to the arteries in her abdomen now. We'll listen to the aorta and the iliacs as they go into the renal arteries. We're basically listening for bruits. So the aorta runs straight down the middle and breaks off to the renal arteries on each side. And then it also goes straight down to her femorals. And she has no bruits. We now check for a hernia if there was some. She has no protruding intestine when you just look at her abdomen. To check for a hernia, if you just lift your head up slightly and do a crunch. Perfect. So, she has no intestine that pops out of her abdominal wall. We move to palpation. We start with one hand and soft pressure, and then we move to two hands to be able to palpate the organs. So we'll start with one hand, flat hand, and again, ass. So one hand, and you palpate the abdomen. It's soft, non-tender. She doesn't grimace or squint. Then we move to two hands, one hand on each, and then more pressure with this. Perfect. Now to palpate the spleen, you start at the left of the belly button and move to, or the right of the belly button, move to the left quadrant, upper quadrant. And there it is. And it's non-tender and non-enlarged. To get to the liver, you start underneath the belly button on the right hand side and go straight up. So she has no tenderness, doesn't grimace. It's like a massage. Okay. So at this point we're going to percuss, and we're listening for the sound and if it changes. So we'll take two fingers and tap on those two fingers. And no sound change or difference. To find the liver, you go mid-clavicular on the right-hand side. You start underneath the belly button again, and you tap, and you listen for a sound change, and it's right there. And then you would come down mid-clavicular from the collarbone down to get to the top of the liver. At that point, you can guesstimate how big the liver is. Okay. She has no tenderness, no guarding, and no tightness in her abdomen. We're moving on to the appendix. So we are going to push in on the right lower quadrant, which is usually pain driven, and tell me if there is more pain when I push in or let go or the same. So moderate amount of pressure, push down in and let go.
More
more in. Typically with any kind of appendix issue, you're going to have more pain when you let go. You can also check if it is on the iliopsoas muscle. So at that point, you put your hand on her hip and her knee, and then you ask her, you put a little bit of pressure down. Come here, Megan. Come here, Bug. Flats. Flats. You're okay. Flats. Thank you. And you ask her to lift her leg up. And if she's having pain or tenderness where the iliopsoas muscle is, that's when you're going to see that on the appendix. We'll move on to the fluid wave sign. So we'll ask our patient to create a wall in the middle of their abdomen. We put one hand on one side, and then with the opposite hand you tap on the opposite side. If the patient has any ascites or fluid in their abdomen, you will feel the wave from you tapping on the other side. So you would tap with this hand, and you would feel it with this hand. And she has no fluid in her abdomen, so I don't feel anything. Two more. The next one is the Murphy sign. So I'm going to push on her right upper quadrant. We're basically testing for cholecystitis or gallbladder issues. So I'm going to push on the right top corner of your abdomen. I'm going to have you go ahead and let your breath out. I'm going to push in with one hand. Take a deep breath. Perfect. And she has no issues with her gallbladder, but if you did, you would get pain or them incompleting their breath when you did that test. And then the last test is the costovertebral angle test. So I'll go ahead and have you sit up and face away from me. So stay right there. So this is measuring or checking your kidneys out. First off, I'm going to palpate her back. If she has any pain or tenderness, then you're going to be more careful. You'll put your hand where their kidney is, and then you'll do a big thump. The first thump will be an easier thump, and then you'll do a second thump to make it a little harder. If the patient is having issues with their kidneys, they will have tremendous pain when you do this. And she obviously doesn't care. And that is the completion of the lymph, neck, and abdominal system. Thank you.